Welcome to the Anatomy of Inequity, a podcast that examines how systems, structures, and history shape health outcomes long before a patient enters the clinic. This podcast is designed for healthcare students and professionals who are willing to look beyond individual behavior and examine the conditions that produce unequal care, because outcomes aren't accidental and inequity has an anatomy.
All right, well, good afternoon. I have a very special guest with me today, again on the podcast, and I am excited to talk to her about her experiences and then share from a wealth of knowledge about health disparities, really from a different perspective than maybe what we are used to in physical therapy practice. So, welcome to the show, Dr. Sherece Thompson.
Thank you.
Yes. All right. So I'm starting off every podcast with the same question. And so my first question to you is, what systems in your childhood most shaped what you believe was possible for you?
That is a great question. I listened to your answer from the first podcast. And I would have to say for me, the systems that helped shape from my childhood starts with school, institution of education. And then secondly, church, religion, spiritual would be the two systems that I can think of. When you think of a system, I think of like an institution or something larger than that. But then I like to add in also just parenting. As a system. It took two parents and a village to definitely shape a lot of what was going on that I felt was possible to be where I'm at today, and think about how did I get here. Definitely, those were the three.
All right. All right. Thank you very much. All right. So, what I didn't share, even though this is Dr. Thompson, I did not tell you what kind of doctor she is. So, Dr. Thompson is actually a dentist. And so that's why this is a different spin on the conversation. One of the things that she and I were discussing that kind of led us here is she talks to her students in her dental hygiene program a lot about health disparities as it relates to dental health. And so we got to talking about this song that J. Cole
Mm,
is responsible for. And I'm just going to read this little stanza and then
mhm.
we can kind of go into the other questions. But I just loved it. So I think this song has been out for a while. It's called Crooked Teeth. And I just like this first little stanza when it talks about crooked teeth. They tell me I should fix my grill because I got more money now. Ain't got to sit around and front like I ain't thought about it. A perfect smile is more appealing, but it's funny how my SHIT is crooked. Look at how far I done got without it. And it goes on and on, but I just thought that that was a wonderful segue to start talking about this conversation. So we were talking about the song, and then we started talking about the book that Dr. Thompson puts her found or sets her foundation on for health disparities when she talks to her dental students. The book is called Teeth: The Story of Beauty, Inequality, and the Struggle for Oral Health in America. So we're going to start off this conversation with a question about that book. I love that you use the book with your students to teach about health disparities. To give you a head start on what oh, here we go. I'm sorry. Let me blah, 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 cut. Here we go. Question 1.
Okay.
The dental divide. Mary Otto writes about how dentistry became separated from mainstream medicine. How do you help your students see that a tooth problem is almost always a whole body or a whole system issue?
That question starts with one of the first classes that have with me in dental hygiene program, nutrition. And in the nutrition book, it talks and speaks. This is an evidence-based book that we teach out of about how nutrition is important. And when you think about nutrition, you can't eat, you can't drink, you can't do anything without teeth. And the concern that we have is that people just want to separate the mouth from the rest of the body. So the great dental divide is back in 2000, the Dr. Satcher, he came out with an oral health paradigm that says the whole body, the mouth, is a mirror or is a representation to the overall health. So to go back to your question, Mary Otto in her book talks about the Great Divide. Many people think, and still do today, that the mouth, dentistry, as I learned it, was supposed to be separate medicine, and it isn't. And we teach from the beginning that the mouth is the gateway to the body. The mouth is the mirror to your body or your overall health. So that's kind of the first sentence I say on my first day of nutrition is you're in this class to learn about nutrition and how nutrition affects oral health and how oral health starts with your mouth. When your mouth is not in good condition or shape, it starts where you can't eat. If you can't eat, you're going to pick poor. You're going to have poor nutritional habits, and poor nutritional habits are going to lead you to health problems. So people don't think that if I don't have teeth, I can't eat the proper foods. The proper foods, healthy foods, will end up causing you to have obesity, heart problems, and all kind of sequela problems. So the first thing I like them to understand is that even though we're teaching about teeth, oral health, it cannot be separated from the rest of the body. It's the gateway to the rest of the body.
I like that. I like that so
Mhm.
much. I was kind of skimming through the book, and
Mhm.
one of the things that was highlighted was the fact that you don't even think about the fact that many people aren't hireable because they don't have teeth in their mouth because of
Mhm.
the way they present. And so that just talked about the one person in the story was talking about how their life just declined. They lost their
Mhm.
job, they lost their home, and it all started because of their oral health. So that was just like a wow moment. So thank you for pulling that together to kind of make that more sense for us. I love that answer.
I want to just add to that, and I'm going to bring it right out of the book. As I was speaking, I couldn't find my page, but David Satcher was the U.S. Surgeon General, one of few African Americans, and he published the Oral Health in America in 2000, and that's when he brought the connection to the world, how we are able to see the teeth and as essence of humanity, and that's where that whole body. The mouth is the gateway to the body and not to separate it. So when you talk about the great divide that's in the book, the author, Mary Otto, brings that up about oral health in America and that it is a connection. It should not be separated as so many people think it is. So I just wanted to make sure I gave the name correctly for your listeners. David Satcher, who was the U.S. Surgeon General in 2000 with his oral health report.
Gotcha, gotcha.
Mhm.
All right, let's move on to number two, the
Sure.
status symbol of beauty. This is talking going back to kind of J. Cole's
Yes.
stanza, the status symbol of beauty. The book talks about the story of beauty. How does societal obsession with perfect teeth as a status symbol make it harder for low-income patients to get the basic functional care they need?
That's another good question. I like to ask my students when they read this book, and there's a question that they have to do an essay on to this, what you just said. And I'm just interested in looking at the variety of answers they have. First and foremost, students find out when they read this book and they think about perfect teeth. We have a little debate about it. We say, do you think having perfect teeth, just like in J. Cole's um, song, can help you or harm you? And what about other countries like Europe that perfect teeth isn't obsessed? Why are we in America obsessed with perfect teeth? So our societal obsession is you must have straight teeth, perfect teeth, and it says in order for you to be accepted. So I have them debate that. Do you think that's true? And I said, what superstar or person out there you can associate whose teeth are not, we say, perfect. And we get into a debate about it. We talk about several artists who had changes to their teeth because they were not considered perfect teeth or they would not be liked about society. So I just want to get that perfect teeth is a status symbol. And I have them tell me why do they think it's a status symbol? Well, it's what we set up. We say, and that's what J. Cole does, is he causes you to think about if am I not successful because my teeth are not straight? Am I no less to somebody else? Well, what about people who cannot get perfect teeth? Do we look at them differently? And we do. If and I'm going to tell you a story about what happens when patients come in our clinic. If they feel their teeth are not perfect or straight, they cover their mouths, and the first words that come out of their mouth is, "My teeth are horrible," or "Don't judge me by my teeth." Now, why would someone say that when they first come in? If you go into a medical doctor and you are obese or you have heart disease or you have cancer, do you think the first question that comes out of that person's mouth is, "Don't judge me because I have cancer," or "Don't judge me because I'm obese"? They don't. But with teeth and what our obsession with beauty starts with our teeth because of a perfect smile that someone started in society, and say you are less than if you don't have the perfect smile. If you are a professional, and I'll go back to a personal story. When I entered dental school, I did not have a perfect teeth. I had crooked teeth. They were sitting all on top of one another. And I felt that no one would trust me as a dentist, as a physician. How would they trust me if my teeth were not straight? And most people coming to me for oral health, they saw the societal sign of perfect teeth. And that was my mindset in dental school. So I immediately said, I have to get my teeth straightened. And I did. But then as I grew into the into my profession and thought about it, I was like, well, that's again a societal thing. I felt that no one was going to take me seriously as their dentist if I had crooked teeth, not straight teeth, not beautiful white teeth. And that was that stigma set upon me when I was in dental school. And even to this day, with our even our dental students and our hygiene students, they come in as they have the desire to want to have that perfect smile because again of what society says about you. You're successful if you do have beautiful teeth, if they're straight, if
Right.
they're white. Hmm.
Yeah.
Hmm.
That can go so many places. So when I think about physical therapists and we look at impairments as what we are going to
Mm.
try to attack or treat when a patient
Hmm.
comes in, I wonder, do we, like you said, when they come in and they're in pain or they come in and they've got some type of weakness, do we look down on them because of that? And maybe there are some implicit biases that we're not even thinking about in regard to that too. So I love that you brought that up. And I wonder, like you said, what it does for our confidence in healthcare professionals across the board, not just
Yes,
dentists.
not
I see
just
it has to be
dentists. No,
big, but
every healthcare.
right, right. Absolutely. Okay. So then we've got to move on talking about the reality that you're faced with working in Chicago. So, teaching in the heart of Chicago, what are the specific barriers you see our local families facing that make oral health feel like an uphill battle?
First, the biggest barrier is access to care. And when I say access to care, I'm going to go into two parts with it. I teach our students that we learn in our community health course about finance. When you don't have dental insurance or any access to health care, whether it's dental or health, you have a barrier. Many patients have no access to a dentist because, unlike healthcare, everyone doesn't get dental care like we can give you Medicaid or Medicare, or if you qualify for Medicaid, or now Medicare has picked up where you can get dental work now as a part of it. That was a big access. So when our president, Barack Obama, came in, past president, he made a change with that, with his reform. Medicare now and Medicaid allows people to have oral health care. So to answer your question, access, which is usually based on finances, they don't have the money. There are many people that are coming in that have health care, but they don't have dental coverage. So the access to it because of finances. And then secondly, just being able to get to a clinic that has access for those patients who are low, or we call the low income based, or as we call it in our clinic, low clinics that are specific for low incomes. But that is the biggest reality I have to teach my students, is because students come to our clinic that is at Malcolm X, not student patients come to us, and the patients that come to us are, many of those patients have no kind of dental access to dental care for but with financing. So the cost, we don't even do any Medicaid or Medicare. We just have them pay whatever, a small amount, a fee, and many of them can pay that. But that is a huge barrier that our students learn early on, even from our clinic, that patients just don't have the income or the finances to even afford dental care. And that again was one of the inequities that Mary Otto speak about in her book, um, as a inequality to oral care, just not having the access or the finances to even afford it.
Gotcha. So let
Mhm.
me just just so my students may not be as familiar with this. So at your institution, you have a clinic on site, and is it designed for anyone? Is it designed specifically for low income? How does that necessarily work? I know that's not a question
Yeah.
out on the page, but I want to
Yeah, let me clarify that. Our hygiene clinic is open to the community. Anyone can access our dental hygiene clinic. It is for prevention. And when people think about dental hygiene is the first step to prevention. We are here as they're taught, they are oral health educators. Many people think dental hygienists are just to clean your teeth. I teach them that is nope. That's yes, you do provide a cleaning service, but first you're here to educate the patient about their oral health and what they can do to prevent going into the disease process, which is gum disease or losing teeth because of gum disease or needing fillings, restorative work to replace what's missing or to take out disease that's in the tooth. So for your students with hygiene and our dental hygiene students, we have a clinic that is designed specifically for patients to come in and receive preventative care. And if they are having trouble or concerns with needing restorative work, they are referred out to what we call low cost clinics that can do that dental work for them. So we don't extract teeth, we don't fill teeth. We are prevention, about all of prevention. And that is an answer to one of the inequities that we have seen in our society for low income families or people or anyone. These clinics is an answer. So our clinic and other dental hygiene clinics all across the state of Illinois is that answer to helping with that disparity.
Yes, yes, that's what I
Mhm.
wanted to get at. So thank you for
Okay.
highlighting that.
Mhm.
All right. All right. So next question. How do you prepare your students to be advocates for their patients when the system, things like Medicaid or if they don't have costs, when the system feels like it's set up for them to fail? How do you educate your students to advocate for those types of patients?
Well, of course, the clinic itself is a way to show students in person, up close and personal, how they are advocates to help them prepare and help people to navigate the system. How I prepare them, also I take students out on community rotations to those clinics that are what we call low cost or what we call federally qualified healthcare centers, where these patients might that are the population or the demographics are patients who are on Medicare or Medicaid or on county care or some form of insurance where it is not your top of the line dental insurance. A lot of those our students get to see firsthand how those patients are cared for who do not have access to insurance. So they get to see it on rotations to clinical sites that are federally qualified. They get to see it with our own patients that come into our clinic where we don't even accept any insurance. We just accept small payment and how we prepare them with courses like by dental public health course that talks about how you advocate, how you promote, how you educate. So those are just some ways in which I prepare or our students are prepared before they leave their program to be advocates. And the definition of a dental hygienist, they are oral health educators.
Yeah,
Mhm.
I hadn't learned that, so I learned something new every
Okay.
day.
They just
So
don't clean teeth. They're oral health educators.
I get it. I get it. I like
Hmm.
that. All right. So then a couple more questions. So this is kind of the PT connection because I'm sure my
Okay.
students are like, well, why are we talking? Because again, I want to remind you that the mouth is the gateway to health. So that is
Hmm.
the why, what the why for this conversation. All right. So then the PT connection. Since I'm training future physical therapists, what is one thing you wish PTs understood about oral health that could help us better serve our shared patients?
Here's my answer. I did my homework on define what a physical therapist is. And
Okay.
here's the words that stuck out. You are movement experts. And if you think about your role in where disability comes about and how you help someone to be able to regain mobility and to get movement back, when you think about someone who's in pain or who has lost teeth or who is not able to function, I want to take it back to nutrition. Again, when you don't have teeth, you can't make the right choices to eat the food. You can, but it may not be helpful. And then that affects your body. So if your body is weak and you can't move, then that is the connection you have with the body. I just want you to remember the mouth is connected to the body. So if anybody is dealing with any kind of disability, where it's in a limb, let's go back to the mouth. Now I'm just dealing with a pain or disability with my mouth. I don't have teeth. I need dentures. I need partials. I can't speak to you because I don't have teeth. I can't chew my food because I don't have teeth. I can't function and do the things my teeth and smiling and talking allows me to do with teeth. That is a disability. So if you can think about a disability when it comes to oral health, that translates to where that patient may be right now in front of you with that physical disability.
Oh, such a good question. And as you're sitting there, I'm thinking like, how do you eat carrots and apples and things that are salads and things of that nature without teeth? And it's much easier to eat softer foods that may not be as healthy for you. And so, yeah, go ahead.
I'm going to take it one more step further. So now we say this person cannot eat healthy foods. So they choose soft foods or foods that are easy to eat. Now we have a person who is now choosing foods that can lead to cardiac health problems, which is heart disease, obesity. And then think about a patient who is obese and you as a physical therapist and helping them get back to when they have an injury. And the first thing a doctor will say is, you got to lose some weight in order for us to be able to have you do XYZ to get that knee replacement or that hip replacement. Well, if I got to lose weight, and I'm just going to take it back. I want you to critically think about this. Okay, well, where does losing weight start with? Well, losing weight starts with the nutrition or the types of food you eat that is healthy for you. But now I don't have teeth to eat those nutritious foods. I can't afford a dentist to make me teeth. So I'm walking around with no teeth, or I have broken teeth that's causing disease in my body. And then the disease in your body from broken teeth and diseased teeth and bacteria from a cavity gets into your bloodstream. And it causes you, again, to lose either more teeth or to even be sick from sepsis because you got bad bacteria floating in your body. So now the doctors get it. Before a patient can have a heart transplant, go have a surgery, do anything, they now have to take a dental form to their dentist, have them cleared that they have no disease, no broken teeth, no infection in their mouth that can hinder their bodies from healing so that they can have this heart transplant or kidney or even have whatever surgery they need to do. They get it now. Medicine gets it now. They didn't get that connection. And I'm like, now we're important, aren't we? Dentists are important. It starts with the mouth. So to get that connection as a physical therapist, you have to think about where it begins. So sometimes just think about, now they're even asking the questions about our mental health. Let's ask about oral health. Do you have a dentist? How often do you see your dentist? When the last time you had your teeth professionally clean? You will be surprised how the bacteria in our oral health moves into our bodies and causes a lot of the problems that our patients are having right now, and especially with diabetes. And think about that diabetic patient that you are the physical therapist to. Why are they diabetic if it's diabetes stage 2 that's leading to the diabetes, the obesity, all starting from the oral health?
Wow, wow.
And that's the connection I get my hygiene students and our dental students. Of course, they know that in dentistry because I teach in the dental school as well. We know the connection. We're just trying to get other healthcare professionals to understand that connection.
Mm. Thank you for sharing that. I
Mhm.
really, really appreciate that, and was like a light bulb went off when you were talking. And you kind of know what you know in the back of your head, but it's not until you bring something full circle like that that it helps you to realize we are holistic individuals.
Absolutely
Yeah,
holistic.
holistic providers.
And I want to thank you for bringing oral health to the forefront with your students because this is what that interprofessional collaboration is about. And I really want to thank your teacher, Professor White, for doing this, because so many of us teach in our bubbles, and we can really be a team of professionals that come together, because that's what we do in real life. We come together and we solve this holistic problem that that patient has. And it's great to kind of work with PT, along with our nursing department, along with other departments that in healthcare, so people get that connection with where oral health meets overall health. So thank you for doing that. I appreciate you having me on, and I do hope your students will at least think about the oral health in connection to overall health.
Love it. I love it. I love it. Okay.
Hmm.
So listen, I could keep on talking to you
I know.
all about it, because I'm just really excited. But I'm going to ask the last question, which is kind of my
Okay.
formal question that I ask everyone as I end the podcast. How are you intentionally, and I think I know the answer to this, how are you intentionally building a legacy that actively dismantles health inequities?
I listened to your podcast and you said legacy matters. And I agree with you. So I'm just piggying back or reinforcing legacy matters. Now, when you said, what will my legacy be? I really feel as a dental educator, my legacy is to first bring awareness. If I can bring awareness and my students understand through awareness why it's important, the why, I should just say the why. A part of my legacy is for them to know the why. And when they know the why, what do you want to do about it to change it? And if they can understand the why and have a compassion or be compelled to do something to make that change, whether they become more educators in the future or they are oral health promoters and education in the community, however they want to do it, whether it's in their community at a higher level or coming back into the school to teach, I feel that I've made an imprint or made a influence on them to make that change, however they want to make that change. And when most of our students leave, they like, I want to do something different. And I'm like, well, I did my job, because that's all I wanted you to do is first become aware and then recognize that you are part of the change and you can make that change on whatever level you want. So that's the legacy I like to leave for my students.
That's awesome, Dr. Thompson. I'm going to end our segment with this. One of the last stanzas of J. Cole's song says, "We got the crooked smile, we can style on them. Background crooked smile, we can style on them. You were the one that was trying to keep me way down, but like the sun, I find my way back around."
Ha,
So I
ha.
just pray that our students understand the legacy and the tie of coming back around to knowing self, but then most importantly, being advocates for others in this profession and in either any profession.
Any profession. Yes, I agree, Professor White.
Yes.
Mhm.
All right. Well, thank you for coming to the show.
Thank you for having me, and best wishes to your students and to my dental hygiene students who will be listening to this podcast as well.
As you move forward in this course, remember this: health disparities are not simply about patients, they're about systems. And as future clinicians, you don't just treat bodies, you practice within structures that either reinforce inequity or interrupt it. Reflect on how this episode connects to student learning outcomes and how that understanding may influence your clinical perspective. This is the Anatomy of Inequity.